If you have ever thought about retiring early, then you probably have also had the thought, well, if I retire now before I turn 65 and become eligible for Medicare, then I'm going to lose access to the health insurance through my job, which I don't want to do that. So I'm just going to continue to work until I'm 65 and when I become eligible for Medicare, which is a very valid concern and thought for a lot of people. But a lot of them, they don't realize that there are coverage alternatives to employer coverage, right? You don't only have access to employer coverage. There are alternatives, which if you were to get onto, then that would ultimately allow you to retire from your job and not have to worry about, I have to wait a few years until I turn 65 and ultimately just retire early. So in this video, I'm going to be going over the 3 most common options that people consider if they're looking to retire early in California. Options number 2 and number 3, these are California specific. I'm Sebastian. I talk to people about health insurance every day. I've seen what works and I've also seen what can cost people big time. The first option is COBRA. So COBRA, essentially what it does is it allows you to continue the coverage that you have through your employer after you've quit. Right? There is a rule that states if your employer employs 50 or more full-time employees, then they are legally obligated to offer you COBRA if you voluntarily leave your job. Right? If they let you go, if you voluntarily leave your job, you can be offered COBRA still. Unless you're fired due to something like gross misconduct, then you're probably not going to be offered COBRA. But otherwise, there's a good chance that you will still be offered COBRA. And again, with COBRA, you can keep the same plan after you leave your job. And you can also decide to switch plans if you'd like to do that. Like, let's just say you have an HMO plan, but you want to switch to a PPO plan. You can make that change. Now, a few more things that you have to know about COBRA is the first thing is you're only eligible for up to 18 months, typically. So if you have 3, 4, 5 years to go until you turn 65 and become eligible for Medicare, then, if you only have COBRA for 18 months, there's going to be a gap between the time you lose it and the time you're 65, right? And you'd have to find a different replacement aside from COBRA. And now the next thing is this is why COBRA is not a viable option for a lot of people. And it's that with COBRA, you are typically expected to pay the entire plan's premium plus a 2% administrative fee. So for example, if you're paying $600 and your employer is paying $600, as soon as you quit and you get onto COBRA, then you're going to be paying the $600 you're already paying plus the $600 your employer is paying. So that's $1,200 plus a 2% administrative fee. And that in itself can make COBRA unaffordable for a lot of people, and which is why it's not a viable option. But it can be a good option if you can afford it and if you really just want to keep the coverage that you have. Now, the second option is arguably the best option for those looking to retire early in California. I mean, this option has allowed a lot of people to retire early here in California, and let me explain why. So the second option is Covered California. All right, Covered California in a nutshell, you have insurance companies that offer plans to Californians. And through Covered California, you can apply for a premium tax credit, which helps lower the cost of your monthly premium. You can kind of think of it as like, all right, well, if you're working a job and your employer is paying towards your health insurance premium, through Covered California, it's instead of the employer paying towards your premium, it's actually the federal government that subsidizes that plan, right? And the tax credits, the lower your income, the bigger the tax credit. And what happens when you quit your job to retire? Typically, your income goes down, right? Which means you can qualify for more of a tax credit. So Covered California is definitely worth taking a look at. These plans, they're fully extensive. I mean, they cover prescriptions, doctor visits, surgeries, ER, you name it. They're probably going to cover it as long as it's medically necessary, right? And when you lose your employer coverage, that triggers a qualifying life event for a special enrollment period. So you can pretty much enroll year round, right? You don't have to wait for the open enrollment period. And a side note, I know a broker in Wisconsin. She owns a very large health insurance brokerage, and she runs seminars for those looking to retire early. And all she does is shows them that, hey, you can qualify for a premium tax credit through the marketplace, and you don't have to work until you're 65, right? You don't have to hang on to your job just because you want the health insurance. You can retire now. You can qualify for a subsidy, get a private health insurance plan, and ultimately just be able to retire early, right? So definitely look at Covered California if you're looking to retire early. Just find a broker, find somebody reputable, and they'll be able to help you enroll, and just look at your options. Right? Now, the third option is not the best option anymore, which is Medi-Cal. All right, Medi-Cal is California's version of Medicaid. All right, it's ran by the state and federal government. They help pay towards medical bills. When you're on Medi-Cal, you typically don't have any costs in regards to your premiums or your health care. Everything is really just paid for by the state and the federal government, which it's typically just for those who are low income or disabled, right? And the reason why it's not a long-term viable solution anymore in terms of getting coverage outside of employer coverage, sometime in 2026 or early 2027, there's no official date that I'm aware of right now, but Medi-Cal or Medicaid in general is going to require you to be working 80 hours per month minimum, right? And they're going to require proof for that, right? And if you're retiring, you're probably not working 80 hours per month, right? So that is why it's not really a long-term solution in regards to replacing your employer coverage and retiring early. So I just thought I would mention that since I know that some of you guys would have questions about that. Now, one thing about Covered California I do want to mention to go back to it is the tax credits starting in 2026 are definitely not going to be as good as they have been for the past few years, which I have made an entire video breaking down why that is. So make sure to subscribe and watch this video so you can learn why the tax credits aren't going to be as rich next year for Covered California.